Hello, everyone, and welcome back to the QCMHA Podcast series. Today, we're here with Tracy Elop, CEO of Carizon, for our first episode of 2021. Carizon is a community and family-focused mental health service working to give people hope for their futures. The agency provides a wide array of services stemming from youth education, preventative counseling, and workplace programs. Tracy has a unique background having worked at Deloitte and transitioning to the not-for-profit space. We're excited to learn about her experiences on this journey and gain insights about the role of not-for-profit mental health agencies. Thank you so much for joining us today, Tracy.
Oh, thank you for having me.
So the first question we're going to start off with is one that we like to ask all of our speakers. So what does being mentally healthy look like for you, and why is it important to you?
So I think mental health really touches all aspects of a person's existence. And, for me, it would be feeling resilient, feeling that I can participate fully in life, having an optimistic attitude, having a sense of balance between the things that motivate me. And, I think people need to think about their own personalities and what will help them the most. But overall, I think balance is key to achieving mental wellness.
That's awesome. And I think that really would resonate with a lot of our viewers just because, of course, being predominantly students, finding balance can sometimes be difficult. So I think maintaining that balance is so important. So that's awesome to hear you kind of speak to that. And I guess kind of maybe would tie into how you've been able to find balance between your professional and your social well-being and everything like that. We'd love to just hear a bit more about what did your journey from the corporate world to working for a not-for-profit agency look like? And would you be able to touch on what inspired this change and how your life, both in a work sense and a personal sense, differ now because of that change?
Sure, that's a lot of questions in one. So let's start with sort of the move between corporate and not-for-profit. I worked in the corporate sector for many years, probably 20 years. I worked predominantly through Deloitte and Touche, and worked in various capacities there in the audit department, in their regulatory consulting department, and then also in the national office. So, I had a quite a long career within Deloitte, and really felt challenged by what I was doing, and truthfully really enjoyed it. And they were really good at helping me balance, getting back to mental wellness again. They were really good at helping me balance sort of my personal life with having 3 young kids at home and my corporate responsibilities. So I have nothing but good things to say about that. And then, my husband and my husband also is a chartered accountant, and we took a year off at one point. We actually just both quit our jobs, which is not a financial accounting thing to do, but we both quit our jobs, and we took our kids around the world. And we backpacked for a year, which, again, was really good for our mental wellness. And, when we came back, then there was sort of a time where we had to decide who was going to do what. We didn't have jobs. And I was able to find a job in a corporate setting. And I went to that setting. But what I found through that was that I wasn't really excited about what I was doing. So I had all these skills that I'd learned, but it wasn't the thing that I felt passionate about. So I had that trajectory that was sort of pushing me to a different place. And then as well, I had been involved as my kids were growing up. I had always been involved with the community in volunteer work. And so I was on the board of a local hospital, really, really loved what I did there. And then the other piece that influenced that was my daughter was diagnosed with autism. And so I navigated through the system of special needs and how to get help. And so I think when I think about the experiences I had with my board work and the experiences I had with personally with our daughter, I think when an opportunity came then to bring myself into the not-for-profit space, it felt like the right fit. And so that was about 9 years ago, and I honestly have never looked back. I've just been so excited to be able to be a part of the community and doing good work in the community that still uses my skills that I developed through university and through my working career, but in a completely different capacity.
That's awesome.
Did I answer all the points of that question?
I think so. It was a big question, but yeah, basically it was just talking about your journey, and I think you kind of touched upon kind of what inspired it and how it's kind of changed both your work and personal. If there's anything else you want to add, but I thought that was a great answer.
Yeah, no,
I find
that's good.
I find your story so interesting because I just started this class that's strategies of social enterprise, and they're talking how like more and more that people with business backgrounds are even needed to run social enterprises and not-for-profit agencies, because it's like you have these skills that are starting to transfer over into NFP agencies and become even more relevant because they're starting to run like businesses, and with those how important those skills are. So I thought it was really funny how I just started this class like in the past 10 days, and then we have this interview, because I'm like, wow, this is such a good connection.
So relevant.
Yeah, it's
and
such good
I can expand a little bit on that, because when I went to the first not-for-profit I was at was a children's rehab center, and it was a place that our daughter had received a lot of services, so I felt very at home there. And when they brought me in, I went in as the chief financial officer, so that's not a stretch as a CPA, but they wanted me to oversee their social enterprise as part of my role. And so what I came to realize very quickly is that people in the not-for-profit sector, and I don't want to generalize, but I have to generalize a little bit, because the nature of people that normally are going into the human services types of not-for-profit organizations, they have a very strong skill set in human services and social work and the profession that they're in, but they don't have the same level of competence and insight into the business practices. And so, yes, you'll all often get that in the finance person. But what I found is that a really, really great finance person or a business person can be used to help distribute that knowledge and expertise across the organization and really leverage and help build the capacity. And more and more, Alex, as you're saying, organizations in the not-for-profit space are trying to diversify their funding, trying to find different ways so that they're not as reliant on government funding to survive. And so what are they doing? They're doing exactly what you said. They're saying, well, how can I run a business that will generate revenue that I can put into my operations? The challenge is that there aren't business people in not-for-profits. And so I always come out at that saying, if it was really easy to make a business successful, somebody else who had better skills is going to do it. And so what we do need is people who have those skills and who have the passion to make a difference in the community in that kind of context. We need them to come into the not-for-profit space and help us build greater ability to serve the broader population.
Mm-hmm.
Awesome. Yeah, I think it's also cool. And I had a guest speaker in the class last semester that was even saying he had a similar backstory where he went from corporate world to a not-for-profit agency, and he was like championing to our class, like, if you're interested in social impact, use your degree and come help us. Like, you will be so useful. And I thought it was so cool. I was like, oh wow, that's awesome. It's great to see the transferability. But I think this segues well into our next question. So if you could you tell us more about your role as the CEO of Carizon? We'd love to hear about the overlap between business and social aspects when working as an executive for a not-for-profit agency, and even just some day-to-day activities that you do, or like just things about your position that you find really interesting or cool.
Mm-hmm. Yeah. Okay. So I have been a CEO now for 5 years. I just, and prior to that, I was at CFO for 4. So as the CEO, it's interesting. A lot of what I do is about relationships. I think relationships are the foundation to any successful person. And whether that's in the for-profit space or the not-for-profit space, if you know how to have authentic, trusting relationships, either with your team members or, in a not-for-profit space, it goes beyond your team members into your community partners, because you don't, in a not-for-profit environment, you don't ever operate in a vacuum. One agency doesn't do everything for everybody. The sweet spot is making sure that as a system, you're all working together. And so a lot of what I've been doing is, building relationships, understanding how we can contribute to the system, but understanding how to leverage other organizations. So a difference then, right, with competitive versus collaborative. In a competitive environment, you're out to enhance shareholder value. You've got your mission, and you're going, and you actually don't care that much about what everybody else is doing. Whereas in the not-for-profit space, a lot of it, if you're really going to serve the public well, a lot of it has to be about leveraging the strengths of the whole system, and not operating separately. So I spent a lot of time with my community partners, and in the last year, I've spent a lot of time on Zoom with my community partners, and really trying to build the system, trying to operate within the framework that government sets out for you. So lately, I don't know if you know anything about Ontario health teams, but we're trying to really reestablish the entire health system so that it circles around an individual person who needs care, instead of, well, you could go to Carizon for this, or you could go to House of Friendship for that, and putting the onus on the person to figure it out. What we're trying to do is build a system that wraps services right around the families. So I think relationships is a big thing. One of the biggest surprises I had going into a CEO role was how much of my time is spent on fundraising. And when I think about the skills, again, at a business level, if I think about the skills that we need in the not-for-profit sector, there's a real opportunity for people to do fund development. And fund development is now a profession. And we have a fantastic person in our organization that does fund development and communications. And we're throwing marketing in there as well. More and more, as you're trying to raise money and diversify funding, having that sort of marketing lens is really important. And we just actually engaged an organization to help us with marketing. So some of the skills that not-for-profits have trouble paying for themselves are really, really helpful. And, as you get into the larger, more sophisticated not-for-profits, they can afford to pay for expertise. They just maybe can't afford to pay exactly what the for-profit sector pays. But you get it back in spades when you consider the satisfaction you have of working towards making community a little bit better.
Mm-hmm.
So I don't know, is there anything else you want me to say about that?
I thought that was a really good overview. Yeah.
I think so
I thought
too.
I thought it was great how you mentioned the competitive versus cooperative. Because I was even learning a little bit about how businesses that are trying to take a more like social focus are moving towards this competitive kind of mindset, that they're competitive, but they're also trying to establish like relationships with like suppliers, consumers, and like engage that in their business model. So I think that's really interesting how you touched on that. But yeah, thank you.
You're welcome.
Yeah, that was great. And I think something interesting about that too is just talking about how your organization overall plays a piece in the larger health system. I guess tying back to that fact of you're kind of working collaboratively with other organizations within the healthcare space, which actually ties into our next question as well. We'd love to just hear a little bit more about how Carizon is tackling accessibility issues regarding mental health services, because this is something with our club that we hear a lot about, people having trouble actually getting the services that they're told are out there and are encouraged to seek out. So especially kind of how are you tackling those accessibility issues, considering how many people are currently dealing with long wait times or high costs for private service?
Yeah, well, I absolutely agree with you. It frustrates me when I think about systems that are really complex and having people who are needing support, and at their lowest time, they don't know where to go. And I just think it's our obligation in the sector to make things easier and easier for people. So the reality of it is there are wait lists, and there are multiple access points a lot of times. But I'll give you an example of something that that our agency and our partner agencies are particularly proud of. About 5 years ago, there were 6 not-for-profit counseling agencies in Waterloo Region, and we all operated somewhat separately. We had different front doors, where you could call any agency. But, if you were struggling with mental health challenges, you pretty much had to say, well, I guess I'll call all 6 of them and put my name on the list on all 6 of them. And then I'll wait for somebody to call me back. And that's not a great experience. And it doesn't actually help us do any system planning. So over the course of the last, about 2.5 years ago, the 6 agencies got together and said, let's do some strategic planning together. Let's figure out a way to make us work more collaboratively as a system to make it easier for people so that when they're in that low point, they know exactly where to go. And so we did that strategic planning process. It set out a roadmap for how we were going to work together, and it allowed us to move forward to have, we ultimately adopted one common system. So we now share a database. That database is housed at Carizon, and we have a centralized intake process. So if somebody needs help, they can call one number, and at Carizon, we can book an appointment in at any of the 6 agencies. So that, you're on one wait list. We've got an easier referral process from physicians who can just refer electronically right into Carizon if they have a patient that needs some help. And we're sort of coordinating that system. We now call ourselves the Counseling Collaborative. And so people now know that if they need help in that mild to moderate phase, they can call us and we'll figure it out for them. So I think systems like that are really, really important. And then at the higher level, in our region, we have a 1-number helpline for more high level needs for crisis support. Same sort of idea. So I think the easier we can make it, the better it is. And we just have to keep striving to do that because wait lists are going to grow over the next few years. It's been a very difficult time with COVID and the challenges that has given to people. So we're really trying to prepare for a great increase in the number of people who need services.
Mm-hmm. Yeah, I think that's amazing to hear about the collaboration and just even looking beyond, okay, how can your organization help people, but just looking to how can we work together to even better serve them. I think that's really amazing to hear about.
And I think you segued well into our next question, which is how has Carizon adapted to the COVID-19 pandemic in terms of service delivery? Just in any way that you could touch on that.
Mm-hmm. We were really, really fortunate because about 3 years ago, we did a whole information system upgrade, which put us into the cloud. And so with our systems being in the cloud, we were able to very quickly maneuver from in-person services to virtual services literally within 2 weeks. And, all of our services were offered. After 2 weeks, we were fully working out of homes. And, I say to people that change management is always really, really hard. And so COVID has been a tragedy for our country, our world. But change management hasn't been an issue because, one of the key things on change management is selling the urgency for change. And so what I would tell you is absent COVID, I bet it would have taken us at least a year, maybe 2 years to get everybody on side with the fact that you could actually deliver effective mental health services virtually. And so if you think about the fact that we were able to do that within 2 weeks, that's quite the change management. So, it's change management in real life. And, so it has been really interesting to see how flexible, how adaptable our people are, and how quickly we could move. I would say with respect to the impact, I don't know if you want me to talk about the impact of mental health services on the community. So we've moved virtually. We've done the things that we need to do. There were certain things, certain types of services that actually we tried to do virtually and we couldn't. And, I would put in that camp. There's it's called EMDR, and it's literally, and I can tell you this as an accountant because I don't know, the clinical part of it, but EMDR stands for eye movement desensitization. I don't know what the R stands for, but literally, if you think about somebody sharing their story, and it's particularly for trauma. So somebody is sharing their story, and just in verbalizing their story, they're actually re-traumatizing themselves. And so EMDR is a modality of treatment where there's no need for the person to actually tell their story. They think about their story and their eyes move in a certain way. And so that's as clinical as I'm going to get. But you can't do that. You can't do that on Zoom, right? The clinician has to be there to sort of monitor that and understand what's happening. So those types of things we weren't able to do online, and we were back to doing face-to-face services really, really safely with people within a couple months. So, by June we were doing that. So overall, I'd say we've been doing virtual where we can, and where we can't be effective, we've opened it up to face-to-face services. The impact of mental health on the community with COVID has been significant. And when I think about the nature of the clients that we serve, we do counseling services. So, that probably is intuitive to both of you. But, some of the services that we provide are really related to the social determinants of health. And, we're in neighborhoods which, are probably underserved, high diverse populations, newcomers who have English as a second language, individuals who are maybe living in poverty and not really, if you think about how the virus has affected you or the pandemic has affected you, I would guess, and I guess I'm making an assumption here, but you're going to Queens. You probably, your families probably live in houses. You probably have your own bedroom. You have your own space. And so I think we don't, and certainly that's my experience. We don't live in the same world that individuals who are living in poverty live in, and they are having a completely different experience when it comes to COVID. And if you think about families of 6 living in a 2-bedroom apartment and the stresses that are on those individuals and how they're coping, a recognition, I think, that has come out of this where individuals in those circumstances may not have internet access. Or if they have internet access, they might have one computer and 4 children are trying to share that computer, all trying to do some sort of online learning while, parents or caregivers who are maybe not in the same types of jobs that allow individuals to work from home, are having to go out. So the stresses on families, the complexity of how this pandemic has affected people is really, really hard to appreciate when you're not living it. And so one of the things that we do at our organization is we ensure that we tell stories of, how people are being impacted so that it grounds us in the work that we're doing and what has to be done. And it gives us support for each other as well. So I think I've gotten a real appreciation for that, even more so. And, I had really almost always assumed that everybody had internet. And now, you know, it's so not true.
Mm-hmm.
And you know, another good thing that's come from this is government has put in place uh, some policies and some thoughts that say that internet is not optional. It's like telephone service used to be, like you must have it. And so they need to figure out a way to make sure that it's accessible to everyone.
Mm-hmm. Definitely. And I think it's amazing to hear about just how, starting off, how quickly you guys were able to respond and kind of pivot to that virtual landscape. And as well, have you been able to kind of identify those more vulnerable people, or the people that perhaps kind of need to be focused on more so now than ever? And I think that's
Mm-hmm.
great. And it sounds like you guys are making a really big difference in the lives of those people. And I
Mm-hmm.
think that ties directly, and feel free to either add a little bit more to that topic or just move on to kind of the second part of this question. But the next question we kind of wanted to ask you was, have you noticed any mental health trends related to COVID-19? And then just in general, based off these trends or just experiences you've had recently, would you be able to touch on some ways you'd suggest for people to work on their mental health on a daily basis to combat the challenges that the pandemic has brought to mental health specifically?
Mm-hmm. Um, so trends, really, I guess, touching back on what I said, much greater complexity of
Mm-hmm.
family situations. Um, in the in the first 6 months of COVID, what we saw was a reduction in calls to family and children's services. So you think that's good, but actually it's not good because all of those situations are still happening in family homes. The challenge is that there were no eyes on those kids. There were no people in schools interacting with those young people in a different way. So I don't think we know what the impact of that is yet. Um, I think there's something else with respect to one of our services that we run is a family violence project. And we do that in collaboration with 10 other agencies. So if we think about violence against women and domestic violence, and you think about individuals who are living out of their homes and being there 24/7 all the time and being isolated, you're you know, sometimes, most times, people are safe in their homes, but there are some people who are not safe in their homes. And so that's a significant challenge for people. Um, I think, you know, people are just feeling so incredibly isolated from each other. And they're not able to do the things that they used to do as easily. And so that is taking its toll on people. Um, I, I've said multiple times to our team members that I'm very worried about the next few months. If you think about when this happened in March and everybody went home, what happened immediately thereafter? Spring came. You know, like, yes, it was difficult. It was scary in a very different way. But then April was here, and then we got outside. And so now we've been living with this for 9 months, and we're going back into it. And now it's not spring. Like, it's the hardest time of the year, and a time when people are already affected by seasonal disorders. And so I really think, um, you know, I hope that there's enough supports out there for people, that people are reaching out to make sure that um, they have a friend, they have someone who can listen to them. They're reaching out for professional help if needed, and um, and that they don't hesitate to do that over the next few months. I think once we get to March or April again, I think we'll see the light at the end of the tunnel. And, you know, the days will get longer, and, you know, the weather will be warmer, and we'll see a vaccination process, and we'll get ourselves to the finish line. But I think right now we're in the middle of the marathon, and, you know, we're all sitting wondering, how are we going to possibly make it through this? And we can only make it through when you're running beside somebody who is going to support you. So, you know, to your second point of, you know, how can we deal with this? I think we have to deal with it by reaching out to each other in different ways. You know, that's on the phone, when it's safe to do so, going for a socially distanced walk, getting outside, doing the things that are still in compliance with the government rules, because it's imperative that we all follow all the rules. This is a really serious virus, and we're not through it. And with the variant coming in, it is going to still impact us. So one thing I would say that's accessible to everybody, there's an app that Carizon has a contract for, and it's available right now to everybody across Ontario, and it's called Woebot. So WOEBOT, and it's accessible on Android and Google devices, or Android and Apple devices. And if you put in the code Ontario when you're asked for it, you'll come to the Canadian version of that app. And it is all about, one of the modalities of treatment is called cognitive behavior therapy. And so this app is more well-being focused, and it allows you to practice things periodically, like gratitude journaling. It points out, it's an artificial intelligence little robot that checks in with you, says, how are you doing today, asks what you're thinking about, asks what you're doing, and then points out some things that maybe you wouldn't have thought of otherwise. So for example, if you say something like, my partner never understands me. Like if he says, what are you thinking about? Well, my partner never understands me. This artificial intelligence chatbot might say, well, you know what? That's kind of an example of all or nothing thinking. Is it really never? Maybe you could try to reframe that a little bit differently. What do you exactly mean by that? And so through this AI chat, you can sort of teach yourselves a few things of challenges that maybe you're experiencing, and reframe how you're thinking about things. So that's one thing that everybody can do. But I think not hesitating to get help when you need it. There was a stigma associated with mental health, and certainly, more and more that stigma is going away as people recognize that it's okay to need help. And actually, most people need help at some point, and everybody just has a different way of getting it. So sometimes you can just talk to a friend or a parent or a coworker, and sometimes there's something that you just maybe need to get a little bit more help with. And there's lots of different ways to do that through a one-time appointment or longer counseling if that's required. But I would say be grateful for what you have, write it down, get outside, talk to people, and just make sure it's top of mind. Ask yourself how you're doing. Check in.
Mm-hmm. That's awesome. That's great advice. Amazing stuff for people to take away too and actually implement very easily into their life.
I think you keep segueing right into our next questions perfectly, because what the next question we had was asking about destigmatizing mental health and just what has Carizon been doing maybe to make people in the community more comfortable reaching out for that help when they need it. Exactly what you were talking about, that because everyone is going to need some sort of support at some point, whether it's like high priority, very severe, or something maybe minor like fixing things on a daily basis. But just if you could touch on what they have been doing maybe to help the community feel more comfortable.
Yeah, I think honestly the key is in talking about it. And so, one of the things that we did, and we've done it for the last few years, it was canceled this year, but we had a breakfast that we co-sponsored with Grand River Hospital locally. It was called Mindful Mornings. And so we brought in prominent people to talk about their challenges with their own mental health and their stories. And, the first year we brought in Stephen Page, who, was in the Bare Naked Ladies, so a band that I grew up with, probably not one you grew up with. And, he talked about the struggles that he had with mental health challenges and how he dealt with them. And then the next year we brought in 3 prominent athletes, or I guess they were in the athletic field, but they were sports personalities, and they gave such a raw, authentic discussion of their own stories and how they've had to deal with things. And there was so much positive feedback just from the idea that people would share. So I'll tell you a couple of things that came from that I remember right now. And one of them was that depression is like this inability to feel joy. And so you don't know, like, it's hard to know what that feels like. But just that inability to feel any joy at all. And so I think giving people a sense of what it means to be depressed and how that can influence them, and how there's no shame in that. I think that's really important. And then the second one is this idea of doing whatever it takes to be happy. So, and what I'm talking about there is, I'm actually talking about medication. That I think there's a stigma associated still with taking medication for mental health challenges. You feel like, oh, I should get off of that medication. And yet, if you had cancer, you wouldn't be trying to get off your cancer medication. I mean, you'd be trying to get well. And so one of the messages that someone said was, do what it takes. Like, if that takes medication, then just take the medication and be okay with that. And, be kind to yourself and do whatever it requires. And so I think the more we have conversations, the more that people will openly admit to having some mental health challenges in their lives. I think that's going to do more than anything. We have things like Bill Let's Talk Day, Mental Health Week, but I think ultimately it comes down to people being open and vulnerable and sharing their stories and normalizing it, and being able to recognize what's happening.
Mm-hmm. That's amazing to hear about, that Carizon is really creating those opportunities for discussion and to hear people really just tell their honest stories. Because honestly, that was the whole thought behind starting this podcast, is just providing that opportunity when we can't do it in person to still have people on and talk about their work and kind of how mental health has played an aspect in their business career or their life or whatever it may be. And it's amazing to hear that you guys are obviously doing that work on a larger scale as well. So that's really amazing.
Mm-hmm.
I guess the final question, I think that was amazing just to hear about your work, specifically destigmatizing mental health and kind of some tips for people to help with their mental health. But just circling back to kind of people who have an interest in moving into the social impact or not-for-profit space, and sometimes that can be a little bit difficult or not as traditional of a career path within the commerce program. So what advice would you give to specifically business students who are interested in working in social impact or not-for-profit and are just not really sure how to get into the field or where to find where they best fit?
Mm-hmm. So for me, the key for me was getting involved at a board level. And that's something that I would recommend to anybody, regardless of whether they want to be in the not-for-profit space or not. Governance of not-for-profit organizations needs people that have really strong skills. And people in the Queen's Commerce program, in the business programs across the province, they have those really strong skills that they can apply to a not-for-profit space and really add value. Because as I said earlier, the people that are part of those organizations within the teams often don't come with that skill. So getting involved at a governance level not only is a great opportunity for individuals in the commerce program to really be able to see strategically where an organization needs to go and get involved at that level. But it also gives somebody a little bit of a perspective on whether or not that is something that they're interested in. And there are so many different not-for-profit organizations. It's not hard to find the one that you are passionate about. And wherever you are passionate, there will likely be an opening. You just have to put yourself out there. And so, even doing some reading on governance and what is governance and what does a board do, I think that would be really important for someone. And summer jobs as well. A lot of not-for-profit agencies do apply for the Canada Summer Jobs programs. And so if that's something that you think you might be interested in, I would encourage people to apply and get experience there as well, and just sort of dip your toe into the not-for-profit space and see what it feels like.
Awesome.
Oh, I think that's really great advice. Thank you.
You're welcome.
Well, that's all the questions that we had, but thank you so much. And I think that this has been so helpful, and I think it's going to be really resonate with all of our viewers. Again, not only were we able to touch on kind of giving people a little bit more insight into what it looks like working in the social impact space, which is an area that sometimes we don't get a lot of information on or people coming to speak to us about in the commerce program. So I think that's amazing. But as well, it's just really inspiring to hear about all the amazing work you guys are doing within the mental health space, and how I feel like you're really making a difference during these really difficult times for people. So I think it's been a great conversation, and thank you so much for being our guest today.
Oh, well, thank you so much for having me. It was a real pleasure.
Thanks so much, Tracy.
Okay, bye.
Bye.
Bye.